So, hi, welcome back to the Bowel Chronicles, where I discuss everything bowel health, your food pipe, your stomach, your large bowel, your small intestine, and what to look out for, what's normal and what's not normal. But today, I'm not just going to talk about anything bowel health. This will be a response to one of the questions in one of my comment sections about how I became an endoscopy trained nurse. So I'm currently the pre-assessment lead for endoscopy in the hospital where I work. Um, how I became an endoscopy nurse. I'm a trained nurse um, for about um, 3 to 5 years of studying nursing. However, I got into endoscopy in 2019. That's where I've been all this while. So I'm skilled in endoscopy, assisting the doctors in performing colonoscopy, flexible sigmoidoscopy, and every other investigation to assess your bowel. You should imagine my first time in the room, the procedure room where colonoscopy was being managed, was being done. It was all strange. I could not identify any part of the bowel, but we've grown. So if you're a nurse already, you're a student nurse, and you're considering being an endoscopy trained nurse, what you need first is your degree as a nurse, be it a diploma in nursing or a degree in nursing, practicing the endoscopy nursing. If you've got the job, you'll be trained on the job. You would have to work with someone who is already trained. You'll be signed off your competency if you get a job in endoscopy. So you don't need a previous experience in endoscopy to practice as an endoscopy nurse. For myself, I never had an experience in endoscopy. I've worked as a general nurse before, but came into endoscopy and I've since loved it. It's a rewarding role if you get it, but on whether you need some certification, you don't necessarily need a certification to be in endoscopy. You rather need to be willing and got the necessary qualifications to work in endoscopy. So when you come into endoscopy, you'll be trained, you'll be guided, you'll be coached, you'll be mentored, you'll be signed off all of the procedures, and then you'll be able to charge the procedure room. You should be able to charge, control the affairs in a procedure room. That's your role. For example, if there is a colonoscopy, as a trained nurse, you should be able to call the shots in the room, set up, ensure that the equipment is set up, ensure that the doctors got the medications to administer to the patient, ensure that the polyps are properly managed, the samples are properly managed and handled, labeled. So it sounds some people, there are various people, it's challenging. It's challenging because the responsibility to ensure that these polyps, the samples, if you've gone through my video, you'll hear about polyps, biopsies, all of them. It's your responsibility to ensure that they are properly labeled, the the locations and the sites where those polyps were removed is what is written on the sample box. And if you're able to establish yourself in on this role, then you have much more opportunity to go on to different specializations in endoscopy. We've got clinical nurse specialists for upper GI, lower GI, stoma nurses, IBD nurses, pre-assessment nurses, matrons, clinical endoscopies a lot of role, even bowel cancer screening nurses. Bowel cancer screening is a big, SSPs are very big people that ensure that the targets for everyone, patients who are within the age brackets to be screened for bowel cancer, are caught on time and screened appropriately. So if you're considering joining endoscopy as a trained nurse, first, like I mentioned, is to have a degree in nursing, the willingness to join endoscopy, that teachable disposition. You should be able to understand the inner workings of endoscopy, in as much as you don't need, you may likely come tabla rasa with regards to endoscopy. You also need to arm yourself with the necessary knowledge. You should be able to know what are the common procedures in endoscopy. You should be able to know what are the indications for this procedure, the basic indications for this procedure. You should be able to know what your roles and responsibilities are. What are the stages and phases of endoscopy? We've got the admission bit, we've got the pre-assessment bit, we've got the procedure room bit, we've got the recovery bit, we've got the discharge bit. You should be able to know this inner workings of endoscopy, so that if peradventure you've got an interview that challenges you on what are the inner workings of the endoscopy unit, you should be able to bring up this knowledge. You should also arm yourself with the necessary knowledge on what you need to know. Your basic knowledge of nursing should not be discarded. Compassion, communication, patient safety, um, um, your diligence, everything needs to be brought. Your duty of care to the patient ought to be brought also on the job. So, if you've still got any question with regards to what qualifications, what you need to do, then you can also ask moving forward. So that's it about endoscopy, and that's what I've done, and that's what I do, and that's what I communicate on. You would have, if you peradventure land the job, you have chances to see different bowel conditions in real time. Like if you've heard about gastritis, you're seeing gastritis there and then. If you've heard about variceals, you're seeing variceals. If you've heard about uh, um, foreign bodies in the food pipe, you're seeing foreign bodies right there and then. So it's a beautiful world of its own, beautiful world of its own. So a rewarding role. You get more informed. You get more informed on what goes on inside, and you can communicate that to the patient. In fact, discharging your patient as an endoscopy nurse, you've got the duty of care to ensure that they understand the disease conditions that was found. They understand their conservative management and what they need to do next. So that's what happens in endoscopy, and for those who are willing, who want to work in endoscopy, the endoscopy unit. So that's it. Any other question you've got, drop it in the comment section. I'll come up here and I will address it to the best of my ability. Sign out. Ciao. Have a nice week.